The nursing process. This is a lecture that I'm actually really excited about. The nursing process is something that you are going to use a lot as a nurse. You use it every day, multiple times a day. So it's something that you're going to get quite comfortable with, that it'll feel like second nature. And it's really exciting because this is like a real good look at what it means to be a nurse and what functions you will do as a nurse. So here we have the steps of the nursing process, and they include assessment, diagnosis, planning, implementation, and evaluation. The acronym that we use for the nursing process is called ADPI. And while these steps are listed here, the nursing process is actually quite cyclical. It doesn't end once we've worked through these steps. And so we're going to explore each of these in a little bit more detail throughout this presentation. This picture here shows that the nursing process is not about working through all 5 steps and then moving on. It's a cyclical process. So we take all our nursing knowledge and nursing theory and apply that to an assessment that we've done on a patient. So we'll take a patient history, do a physical assessment of them, and from our assessment, we're going to determine some problems or priorities that have taken place. And from that, we're going to identify a nursing diagnosis. From our nursing diagnosis, we're going to create goals for our patient. And the idea is that these goals are going to help us overcome the problem or meet the needs of that nursing diagnosis. After we have our goals identified, we're going to pick interventions that are going to help us meet those goals. And then we get to evaluation. And evaluation is the big part of the nursing process. That's where we determine if we can continue on with our nursing process, or if we need to go back and maybe change our nursing diagnosis. Maybe we didn't have the right one in the first place, or maybe we need to change some of our interventions. So it's a constant process. So the first step of the nursing process is assessment. And so we're going to dive into what assessment is a little bit deeper. And the first thing I want to talk about is critical thinking and assessment. So critical thinking enables a nurse to have a broader perspective of the patient. It allows you to collect data in a way that elicits openness from your patient or client. Basically, you want your assessment to be systematic, and you want to determine your patient's current and past health status or functional status, determine their past and current coping mechanisms, and really get to know your patient. And to do that, you need to be able to critically think in order to get the right information out of your patient. So there's 2 types of data that we're going to collect from our patient when we are performing an assessment on them. The first is subjective data, and this is a client's verbal descriptions of a condition. So I always remember the S in subjective means speak from your patient. So it's your patient saying, I have pain in my chest. Whereas objective data is observations and clinical measurements or assessments. And so I always remember the O from objective is consistent with observe. So that would be you performing a blood pressure and realizing that it's 162/90. That is a clinical measurement that you were able to observe. So we know we can get different types of data from our patients, subjective and objective data. But where are we going to get that data from? What are our sources for data? So the biggest source of data will be primary, and that's from your client. That's from the patient themselves. They're able to give you that subjective data, and you're able to perform an assessment to gain objective data from them. However, sometimes patients are poor historians, or they have a disease process that makes it quite difficult for them to actually give you the information that we need. And this is where secondary sources can become quite useful. And this can include asking family members or significant others, other members of your healthcare team that have maybe worked with that patient before, or going through past medical records for a patient to gather the information that you need, especially if the patient is unable to give it to you. And then we have tertiary sources, and these are your least ideal sources of data, but they do play a role, especially your nursing experience. If you are witnessing something in a patient that is consistent with another disease process that you've also had experience with, then it can kind of raise some red flags and allow you to ask the critical questions that might need to be asked. So, how can we get the data that we require from our patient? And an interview is probably a really good place to start, especially as a first year nursing student when you don't necessarily have the skills to perform a physical assessment. An interview or an organized conversation with the patient is going to get you the data that you need. You can ask open ended questions, which are going to elicit a response from your patient, or close ended questions, and this can be yes or no questions. There's 3 phases when you're performing an interview. So your orientation phase is when you're introducing yourself to the patient, you're getting to know the patient. The working phase is when you're actually getting the information that you need, you're able to ask questions and really get into the nitty-gritty stuff. And then the termination phase of an interview would be saying your goodbyes and ending the interview. So a cultural assessment is a really important consideration when you're performing an assessment on a patient. And you should conduct any assessment with cultural safety. And we're going to dive deeper into what cultural safety is near the end of this course. But basically, cultural safety means an environment which is spiritually, socially, and emotionally safe. And this is a super important part of your assessment. When performing a nursing health history, we want to take all of the following into consideration. So the types of data that we have, so objective versus subjective, sources of the history, so whether they are primary, secondary, or tertiary, reason for the health history interview, so is it a new admission, is there something new going on, current state of health for that patient, and how that compares to their previous health, developmental, spiritual, sociocultural, and physiological variables. And your physiological variables include understanding of previous illnesses or injuries for that patient, their current medications, and a review of their bodily systems. So while you might not have the nursing skills to perform a physical examination yet, 90% of physical examination is actually observation of your patient, which you are totally capable of doing as a first year nursing student. And just by observing your patient, you can actually learn quite a bit about them. So whether they've got a really unsteady gait, whether they're all of a sudden not able to lift their left side, but you know they were able to last week, all these things are really important information and lead to data which can be then analyzed and interpreted. Once we've gathered all our data, we can start doing some data analysis. And this includes recognizing patterns or trends in the data that we've collected. We can compare what we've found out about the patient to normal standards, and then we can make a reasoned decision. The final aspect of assessment is data documentation. So basically, we need to put somewhere all the information that we've collected. And documentation is a nurse's legal and professional responsibility. Anything you heard, seen, felt, smelled should be reported accurately and as such. Subjective client information should be placed in quotation marks, and accurate terminology and abbreviations must be used when documenting. The next step in the nursing process is a nursing diagnosis. And a nursing diagnosis is a clinical judgment about client responses to an actual or potential health problem. So an example of a nursing diagnosis might be impaired skin integrity related to diabetes and immobility. Whereas a medical diagnosis is the identification of a disease condition on the basis of specific evaluation of signs and symptoms. So an example of a medical diagnosis is type 2 diabetes. And a collaborative problem is an actual or potential complication that nurses monitor to detect a change in client status. So this could be nursing assessing patients for hypoglycemia related to their diabetes. A nursing diagnosis focuses on a client's actual or potential response to a health problem, rather than on the physiological event, complication, or disease. So we're not so worried about ineffective gas exchange as we are the patient is experiencing shortness of breath. So we're treating the client's response to a health problem rather than treating the disease itself. NANDA International is an organization that creates a means of translating nursing observations and assessments into standard conclusions and common nomenclature. So what that means is that NANDA is an organization that is extremely well known, and they provide a list of nursing diagnoses that is common knowledge, or it's well known amongst other nurses. So when we are communicating with other professionals, they are aware of what we're actually talking about. So it provides a precise definition of a client's needs, and it gives all members of the healthcare team a common language to use. This will be really important when you're choosing your diagnoses for your care plan, because you want to pick NANDA approved diagnoses. When you begin to prioritize a nursing diagnosis, it involves a level of critical thinking and nursing diagnostic process. And diagnostic reasoning is a process of using assessment data to create a nursing diagnosis. So you can't determine a problem if you haven't assessed your patient yet. The defining characteristics are the clinical criteria or assessment findings that act to help confirm an actual nursing diagnosis. So if you're performing a bed bath and realize that a patient has a skin breakdown on their coccyx, then they have impaired skin integrity. And clinical criteria is the objective and subjective signs and symptoms that lead to a diagnostic conclusion. There are different types of nursing diagnoses. The first one is an actual nursing diagnosis, and this describes a human response to health conditions or life processes. So impaired skin integrity related to immobility would be an actual nursing diagnosis. An at-risk nursing diagnosis describes a human responses to health conditions or life processes that might develop. So a patient might be at risk for developing impaired skin integrity related to immobility. A health promotion nursing diagnosis is a clinical judgment of a client's motivation and desire to increase well-being, and a readiness to enhance specific health behaviors, such as nutrition or exercise. Patient education would also be a good example of a health promotion nursing diagnosis. And finally, we have the wellness nursing diagnosis. And this describes the level of wellness in a client that can be enhanced. NANDA International actually does a fantastic job at identifying these components of a nursing diagnosis. So when you go and look at a nursing diagnosis with NANDA, it'll include all of these components: a diagnostic label, the related factors, a definition, risk factors, and support of the diagnostic statement. Now that we've identified a nursing diagnosis, the next step in the nursing process is planning. Planning begins after we've determined a nursing diagnosis, and the nurse sets client-centered goals and expected outcomes. They plan interventions and prioritize those interventions. The planning stage of the nursing process requires critical thinking, applied through deliberate decision-making and problem-solving. The planning stage of the nursing process is all about goals. So your goals of care is that they should be client-centered, and you should have short and long-term goals. So a client-centered goal is a specific and measurable behavioral response that reflects the highest level of wellness and independence for your patient. A short-term goal is an objective client behavior or response that is expected within hours to a week. And a long-term goal is an objective client behavior or response expected within days, weeks, or months. Clients play a very important role when you're determining goals. Goal setting should be mutual in nature, and it should include the client and their family. And they should be included as active participants when determining goals. Even though the nurse is performing the assessment and maybe determining the nursing diagnosis, a patient needs to be aware of what their goals of care are. And as a nurse, it's your responsibility to make sure that they are educated and aware. Expected outcomes refers to the specific measurable change in a client's status that is expected in response to nursing care. So it provides focus and direction, and it ultimately allows you as the nurse to determine when a patient's goal has been met or unmet, and if there's changes that need to be made to a nursing care plan as a result. When you're writing down clients' goals, it's important that they are client-centered. You have made them in mutual discussion with your client, but they also need to be written SMART. And what SMART stands for is specific, measurable, attainable, realistic, and timely. The next step in the nursing process is implementation. The implementation step of the nursing process is the initiation or completion of planned actions or nursing interventions. So, nursing interventions might include mobilizing a patient up to a wheelchair 3 times a day for meals, or turning a patient who is immobile every 2 hours. And there is direct care and indirect care nursing interventions. Nursing interventions that require direct care with a client include activities of daily living, and this would be things like brushing your teeth, grooming and hygiene, getting dressed. And instrumental activities of daily living are the things that you need to do to survive in society. So things like banking or transportation, getting groceries and making meals. Physical care techniques, life-saving measures, teaching and counseling for your patient, controlling of adverse reactions, and preventative measures. So these are all things as a nurse you will have to do directly with your patient. While the direct care nursing interventions get more recognition, indirect nursing care measures are just as important. Communication and communicating nursing intervention is super important to make sure that everyone is on the same page. And while you might not be providing the direct care yourself, you might be delegating, supervising, or evaluating the work of other staff or members. So this doesn't mean that you are supervising a care aide to do the work that you can do. It might be requesting the help of a physiotherapist with mobility because it's not your area of expertise. There's different types of nursing interventions, and a nurse-initiated intervention is intervention that does not require an order from a healthcare provider. So this can include turning your patient every 2 hours so that they don't develop skin breakdown. A physician-initiated intervention is an intervention that requires an order from a healthcare provider. This might include putting a medicated cream on skin breakdown. And a collaborative intervention is an interdependent nursing intervention, and it's established in an interdisciplinary healthcare team. So like I mentioned on the last slide, this might be including physiotherapy or occupational therapy to help with mobility or activities of daily living for your patient. When determining nursing diagnoses, nursing goals, and nursing interventions, establishing priorities is essential. So high priority nursing diagnoses are things that involve your ABCs or safety. ABCs is your airway, breathing, circulation. So if someone's choking on something, that is a high priority nursing diagnosis because their airway and breathing is compromised. Whereas a lower priority nursing diagnosis might be skin integrity, especially if you have someone that is not meeting ABCs or safety requirements. When selecting nursing interventions, they need to be consistent with your nursing diagnosis and the goals that you've identified with your patient. They need to be evidence-based. You're not picking interventions out of left field. You need to find the evidence to support the decisions that you are making for your patient. And they need to be within your scope of practice. As a first-year nursing student, it is not within your scope to administer medications, and so this should not be listed as a nursing intervention on a nursing care plan for a first-year nursing student. Standard nursing interventions need to follow clinical practice guidelines and protocols, which means that you're not just doing things willy-nilly. You need to actually follow clinical practice guidelines that are available to you. And you also need to respect medical directives or standing orders. So if a patient does not wish to have a feeding tube placed, then we are not doing that as a nursing measure because that is not in line with the medical directive from the patient. When you begin to actually implement the interventions that you've outlined with your patient, you're going to be constantly reassessing the client, seeing how they're adjusting, seeing how they're doing to the interventions that you have outlined. And you're constantly going to be reviewing and revising the existing nursing care plan. If something isn't working, revisit it. If something is working, then what can we do more of it? And organizing resources and care delivery is a big aspect of implementation. So, asking a physiotherapist to set a patient up with a walker to help with mobility, and organizing the different personnel and environments for the client is a big aspect of the implementation process. Finally, we have evaluation, and this is the final step of the nursing process, and it involves two components: an examination of the condition or situation, and a judgment as to whether change has occurred. This is arguably the most important part of the nursing process. Evaluation is an ongoing and continuous process, and it requires a certain level of critical thinking. Critical thinking is what allows us as nurses to determine if our nursing care plan was effective and if our desired outcomes were met for the patient, and if they weren't, what things need to be changed. The evaluation process includes 5 steps, and the first is identifying the evaluative criteria and standards. And so that's basically identifying what the desired outcome should have been. And then we collect the data and determine whether the criteria or standards were actually met. And then we interpret and summarize the findings, document our findings and any clinical judgment, and then we determine whether we can terminate the care plan, we need to continue it, or revise it. In summary, nurses play a key role in the ongoing improvement of client care. After working through the nursing process with the patient, you're probably going to work through it again. It might be on a different issue or diagnosis. It might be on the same issue and diagnosis. The beautiful part of nursing is you get to work with really interesting people, and they're going to have multiple aspects to their health that you get to play a role in. And the nursing process plays a big role in how you care for your patients.